Good evening, everyone. My name is Shiromee, Project Manager in the Engage Outpatients program, working closely with HealthLink and obviously LHD and the PHN as well. Thank you for the opportunity to present. So we're very excited to share a bit of an overview about the program. So this is the overall end-to-end solution you see here. Essentially, it's digitization of the referral journey from start to end, all the way from when the GP makes a referral for patient into the public health system, all the way through to the hospital EMR. And in CCLHD's case, the hospital EMR component is coming a bit later, but that's essentially what we're looking at. So you've got the HealthLink, which is a preferred vendor for the state. It's integrated with the leading practice management software listed there. There's secure integration with our electronic referral management system, and then in that system you have the receiving, screening and triaging processes that happen where the LHD are able to do two-way interaction securely. Switching to the next slide. So there's a lot of key benefits there. So there's near real-time and acknowledgements, visibility of the local service specialists, and it's fully integrated with the GP software. It pre-populates, that's a great advantage. You're able to see a copy of your referral in there. It reduces manual processes from the LHD perspective as well, speeding up the provision of care for the patients overall. You can see there's a number of different places where we send the notifications. So on receipt, immediately when the referral's triggered, a notification goes back to the GP as well as the patient. On hold, it goes to the GP as well. So when the LHD require more information for the referral, they could put the referral on hold and send that two-way communication, which goes back into your practice management software, allowing you to respond to that. And also, they're able to send a message on what's required specifically. So that two-way communication I touched on earlier, screening outcome when it's not accepted. And if it's accepted, it just goes to the next step. Then if it's a redirection, say in case the LHD determined that's not the best way to provide care, that they've got a better suited facility that can provide care, you'll get notification of that. And triage outcomes as well, you'll get a notification whether it's accepted or not accepted. So a lot of notifications that go both to the GP and the patients at different times that keep the people informed in the cycle at all stages. As you can see, it's an example of one of the practice management software. You can see the highlighted HealthLink icon, which is where you can launch the form from. Once you click that, you're in the patient context already. Once you click that, you'll see a landing page like this. Obviously, it won't be as busy as this because this is from our demo environment. There'll be a lot fewer links, but specifically highlighted there, you can see from a Central Coast perspective, New South Wales outpatient referrals link for Central Coast. You launch that and then you get a list of services from where you launch the form that you would like to refer into. You launch the, you select the clinic, which will launch into this kind of a form. Just a quick overview of the form here. So you've got the ability to refer to a named practitioner or leave it as unnamed in keeping with Medicare practices. There's referral types, new, updated or continuation. This triggers relevant workflow on the receiving end as well. Also referral validity period, and then you've got an opportunity to select your assessment of the priority, and then the LHD will also make an assessment on the basis when there's an opportunity to communicate that in your referral, and then patient suitability for virtual care and short appointments at short notice. On the sidebar here, you'll see attachments and reports. These are all loadable from your practice management software or from your PC. medications and alerts. Similarly, you can select what's relevant for the referral. Similarly with medical, social and family history, patient information and referrer information also pre-populated from your practice management software, allowing you to expedite the referral process so that there's no overly burdening manual processes there. I'll hand over to Shiromee for this section here.
Yeah, thank you, Sid. Thanks, Sid. Just in terms of CCLHD, our project scope, so we have chosen 4 clinics to go live with this program. So we've got gynecology, antenatal, pediatrics, and neurology, and that's within the specialist centre. In terms of the forms that you'll complete, we've got 3 specialty forms and 1 pediatric generic form. And in terms of these referrals and progressing into the future, we're looking at ceasing faxes because there's nothing smart about fax and paper at this stage, and we're looking to really encourage e-referral uptake throughout these 4 services from our GP community. In terms of how we're engaging our GPs, just to the next, yeah, thank you, Sid. We've done quite a bit of work with the PHN, and we've got a few different landing sites that you can visit to find out more information. We've done a practice manager webinar, which was emailed out to all the practice managers, and we'll be looking at doing a GP focused webinar on the 10th of April, which you're all more than welcome to attend. We've had a few feature articles go out, some flyers, and we're sending letters to different GPs and practice managers just to try and rally up some excitement and to increase the adoption as well. And we've also had a period of soft go live as well, which I'll talk to in a little bit as well. On the next slide, we've also just got essentially a bit of a breakdown of our comms. So just a high level summary of how we've tried to engage quite a few GPs in our district. On the next slide, we've got our key milestones. So what have we done so far? We had a soft launch, and that was on Tuesday this week, and that looked at trying to engage 79 different GPs within our community across 11 different practices, encouraging them to send e-referrals through to us so we can practice triaging and processing them in our new software system. It also allowed notifications to go out to referrers and patients on the progress of the referral, and in this period, in this soft go live period, we'll continue to process non-e-referrals as they usually do. So if faxes do come in, we'll process that as usual. But starting the 9th of April, we are really discouraging the use of fax and pushing e-referrals. So as I said, 9th of April is our hard go live. So we'll look at trying to essentially look at all the referrals coming in and encourage that e-referral uptake even after the go live period. So we'll continue to engage with the GP community and look at trying to communicate that message back to our GPs. Just that in terms of resources, how can you find out more information? How can other GPs find out more information? As I said before, we've got quite a few different landing pages that they can visit. And there are also links to how to kind of set up HealthLink and access the forms from different practice management software systems as well. If you want any further information, you have any questions, feel free to reach out to any of us. On the left, we've got our digital health team, and on the right, we've got our e-health team as well.